Assalamu alaikum. Welcome to Islam Explained. We are joined by Dr. Zuleyha Keskin. Welcome to the program again.
Thank you for having me again.
It's always a pleasure having you on the show. Now, I'd like to ask the question, depression. It's a common topic in today's society. How does Islam view it? How does it tackle depression in today's society? Before talking about Islam's approach to depression or mental health, more broadly, what are some comments you'd like to make about mental health generally?
Okay, let me just first put out a disclaimer that I'm not a mental health professional or practitioner. I have done my PhD on inner peace from an Islamic perspective, so I do look at the notion of inner peace, contentment from an Islamic spirituality perspective. But obviously there is an overlap between these different disciplines like psychology and Islamic spirituality, and this overlap is very newly being explored. So that disclaimer out first.
Sure.
But with regards to mental health, I guess depression, but more broadly mental health, there are a lot of stigmas attached to it in wider society. I think it's an area that's not understood very well, but it's a growing area that needs to be tackled, especially amongst our youth, but not exclusively with our youth. So these stigmas make it difficult to talk about, but unless we talk about them, we're not going to be able to address them.
Now, many Muslims say that a person that has a strong faith, they shouldn't fall into depression. Would this be true in the way you look at it?
I think this approach is quite problematic, and it causes a lot of strife for people, especially for a Muslim who has depression. Being told that if they had strong faith, they wouldn't have depression, it's almost suggesting to them that they're weak in faith, there's a problem with their faith, or they're not doing their prayers properly. So it really has huge implications for the person who is experiencing mental health. And I think we need to realize that depression, approach to depression is more than just a spiritual approach. A spiritual approach is very important, and I think one of the reasons why people make those claims, like that if you have if you have strong faith you wouldn't have depression, in the Quran it does mention in chapter 13 verse 128 that in the remembrance of God do hearts find rest. So a person can interpret that as saying, well, if you remember God, if you do dhikr of Allah, remembrance of Allah, then you're not going to experience depression. But I think that's simplifying it too much. No doubt having faith would contribute positively to mental health, but to say that it's be all and end all, that's all you need, that could be very misleading and problematic.
Yeah, and also by saying that to the individual that is suffering from mental health, that might even spiral down more, and might cause even further problems.
Absolutely, because that's right. If they've got depression, they've already got, I guess, internal dilemmas, and then you're adding to that by saying, well, you've got weak faith, or you're not a good Muslim, and that's not going to help.
It's not helping. It's making the problem even worse.
Absolutely.
Now, what would Islam's stance be on therapy like counselling on individuals?
Yeah, look, it's an important part of the overall treatment. Think of it even like a medical treatment. Even with medical treatment in Islam, there are treatments or therapies that are suggested that are predominantly spiritual. There are certain prayers that you can read to even that are meant to help you with physical ailments. But it's fairly accepted in our society that you would still take on medical treatment. You would still see a doctor. You may, incorporate those spiritual treatments, but you would still see a professional who can help with those physical ailments. I guess psychological ailments, if we can put it that way, or mental health is the same. You would take on those spiritual treatments, whether it means doing more prayers or trying to strengthen your faith through classes or readings. But you would also consider treatments like counselling, even medication. We know that there are medications like antidepressants, antipsychotics. Again, to say that if you go to spiritual doctor, you won't need to take those medications is very problematic. They need to work together hand in hand and try to address the situation accordingly, and especially depends on the seriousness as well.
Yeah, so it is recommended that we do get professional advice or professional help rather than trying to curing ourselves or trying to overcome it ourselves. It is a sickness, so rather than letting it go, it is best to get professional treatment.
Exactly, and I think the key point with that also is that it would be best if a person was to seek a Muslim professional, because, as I said, the spiritual aspect of it is important. So if you're able to go to a Muslim psychologist or a Muslim psychiatrist, they are more likely to be able to understand your other maybe treatments or therapies or methods that you're using, and they may be able to incorporate it. But as I said, this is a very new area. There's very little literature on it, but there are some psychologists who are bringing in that spiritual aspect to current established psychological treatments. So we'll probably in the next 5 or 10 years, we will see that there will be more established collaborations, I would say, between the psychological and the spiritual methods, which will be to the benefit of the patients.
Okay. Well, I'd like to thank you for going into the area of depression, and I'd like to thank our viewers as well for joining in and viewing Islam Explained, and we'll see you next time. Thank you.